I have to say that we're lucky in this state, Minister, that we have widespread public support for the broad sweep of measures that we're implementing. We don't have the same difficulties as other countries have. But the public do want solutions, and they want to see quicker action and decisive action taken to address the COVID-19 surges. We need to see a much quicker rollout of the booster vaccine programme, and this has been referred to by government deputies as well. It needs to be ramped up with additional centres in additional locations, as well as greater GP involvement and pharmacies. We need to get up to the pace that we were at in June and July, and I think you referred earlier on to 300,000. Push it up to 300,000 and beyond it, if possible. We need to gear up that, because the winter is going to be more trickier. It's going to be trickier to control this. We also need to deal with the issue of antigen testing. Workers and families need access to affordable antigen testing on a regular basis. We've been asking for antigen testing to be looked at as far back as 18 months ago. Right now, outlets are charging up to €15 for a single antigen test. If you want to slow down the spread of COVID, we need asymptomatic people who are asymptomatic to be regular test themselves and to avoid unknowingly spread the virus. We need greater access to PCR tests. That's also required for those who do have symptoms. And we have to try and deal with this issue. This is really important, that people have access to a very accurate PCR test. People are having difficulty accessing the PCR centres. We need more walk-in centres opened so as the public can have access to them and to slow down the spread of the virus. Just in relation to healthcare facilities and hospitals, the government has had, and I know we came into this crisis under capacity, less than half the beds that we need in ICU. That's accepted now. But we've had over 18 months to respond to this. And I know it can't be magicked up. There's specially trained staff and all of that. It's not as simple as just putting a bed into a room. But we have to try and improve ICU capacity. We have hundreds of people on trolleys. We have that every winter. We knew this was coming. And the capacity issues are nothing new. And I want to just highlight to you, in the case of Portlaoise Hospital, there's only 2 permanent ICU beds. In Tullamore, there's 4. And if you do the maths on that with the ratio per population of the region, it's way under what's required. And I would ask you to look at that as we move out ahead, that we increase that capacity in both Portlaoise and Tullamore Hospital. In our budget, and we were serious about this, we didn't do it for the fun of it, we put forward a serious proposal in relation to the allocation of funding for 600 extra acute beds, 34 ICU beds. I know the government proposed 19. Every bed is welcome, but we believe we need to go further than that, and 194 specialist beds at a cost of £124 million. This includes 2,500 extra staff. We need to see that level of ambition coming from the government. So to conclude, Laskin Corley, there has been a lack of urgency. There has been some foot dragging from the government on this. We're living with a virus now for almost 2 years, yet we're still trying to play catch-up. We need to be more proactive, we need to get ahead of it, and we need to up our game. Thank you.